Hey there, viewers! We all like having our living spaces neat and organized. Being hygienic is important. But what if you're obsessed with cleanliness? What if perfectionism isn't enough? Extreme perfectionism can be a sign of Obsessive-Compulsive Personality Disorder, or OCPD. In today's video, we'll be discussing OCPD in detail. What is it? What are its symptoms? Why is it often confused with Obsessive-Compulsive Disorder, OCD? We'll be talking about all of these and more. What is OCPD? Is it different than OCD? If you have Obsessive-Compulsive Personality Disorder, OCPD, you're the type of person who likes everything neat and organized. While that itself may not be such a bad thing, people with OCPD strive for extreme perfectionism. This becomes debilitating, especially when they want to see the same perfectionism in their external environment. Sometimes OCPD gets confused with Obsessive-Compulsive Disorder, or OCD, but they're completely different. If you have OCPD, you tend to believe that your way is the only right way and that everyone else is wrong. Characteristics of people with OCPD include finding it hard to express their feelings and maintaining close friendships. People with OCPD are hardworking, but only because the need for perfection makes them feel inefficient. People with OCPD have a sort of complex where they feel righteous over others. This could often lead to social isolation. Their depression also comes with anxiety. On a scale of 0 to 10, how clean do you prefer your home to be? Share your preferences with the Bestie community in the comments below. What causes OCPD? It's not yet fully known what causes OCPD. It's thought that a combination of genetics and experiences from childhood could be the cause. There have been some case studies where the participants revealed having characteristics as children. It's possible that the need to be a perfectly obedient child is one of these characteristics that contributes to adult OCPD. Who are mostly at risk? Experts suggest that men are twice more likely to suffer from OCPD than women. About 2 to 7% of the total population suffer from the disorder, which means it's the most common personality disorder we have. If you're already suffering from other mental health issues, you may still be diagnosed with OCPD. Also, if you have an extreme case of OCD, it's quite likely that it will also turn into OCPD. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. Symptoms of OCPD. One of the signs of OCPD is your inability to complete a task. The need to be perfect is so overwhelming you can't finish anything. You also tend to be formal and proper. While being careful with money is not necessarily a bad thing, you take it to an extreme level. In other words, you're cheap. Another bad symptom of OCPD is the need to be punctual, but once again, this goes to extreme levels. You always pay extreme attention to details. OCPD may also cause you to neglect your relationships. You're so involved with your work, you forget about friends and family. You will also find yourself not trusting others with work out of fear they won't do it correctly. You will also be hoarding items, even when they're no longer as useful. You'll end up with a big pile of stuff you no longer need. It's almost like this goes against your desire to stay organized. After a while, you'll lose track of all the stuff you own. This would drive anyone nuts. Before we move ahead, here's another video you might like to watch. Just like your body, your brain needs to be healthy to thrive. Here's a video on 9 foods you should eat to boost your brain function and memory. Treatment for OCPD. If you've been diagnosed with OCPD, there's 3 types of treatment you can undergo. Number 1. Cognitive behavior therapy. Cognitive behavior therapy, or CBT, is a common form of counseling used by mental health professionals. You meet with your doctor for regular sessions. Here, the counselor will help you through whatever's causing your anxiety, stress, or depression. Your counselor will try to encourage you to reduce the amount of importance you place on work. Instead, they'll redirect you towards interpersonal relationships, recreational activities, and family time. Number 2. Medication. When the doctor diagnoses you with OCPD, he may also start you off on medications such as selective serotonin reuptake inhibitor, or SSRI. This particular medication helps to reduce the anxiety stemming from your obsessive-compulsive cycle. Although long-term medication is not recommended for people suffering with OCD, so along with prescribed medicines, you should also look to attend support groups and continue to get regular treatment from your psychiatrist. Number 3. Relaxation training. With this, you'll be shown some breathing and relaxation techniques that will help you reduce your stress levels. Yoga and Pilates are examples of the techniques you may be taught as part of this exercise. Outlook. It's not all doom and gloom if you've been diagnosed with OCPD. In fact, it's one of the personality disorders that has a better chance of recovering. When you start treatment for OCPD, you will become aware of how your behavior is affecting the people around you. When you have this disorder, the chances of getting addicted to drugs or alcohol are really quite small. This sets it apart from other disorders where addiction is fairly common. The important thing with OCPD is finding the right treatment that works for you. As with all personality disorders, one form of treatment that has worked for most people may not necessarily be right for you. Figuring out which one works is part of the process. If you're worried about hurting your loved ones, CBT can help with that. It can improve your interactions with your loved ones and make you more empathetic. Support from loved ones. You can also look out for symptoms of OCD among your loved ones. If your partner or a family member is displaying signs of obsessive-compulsiveness, you need to figure out what is affecting them. If the behavior is limited to just a few areas of their lives or is irrational and motivated by danger, it's likely to be OCD or some other personality disorder. People with OCPD are unlikely to change their ways and instead see other people as the problem. People who do get treatment for OCPD generally do so at the request of family members, but it can still be hard to bring it up to them. No one likes to be told that their behavior is unacceptable, and confronting a person over theirs may put a strain on your relationship. If you're living with a loved one with OCPD, you need to get some support for yourself as well. There are various support groups that can help you cope with the situation. The most important thing you can do as a loved one is understand that their search for perfectionism is part of their psychology. Before you clash with them, ask yourself if it's really worth it. It could just make things more difficult. You should also learn to let it go when the person prefers to do something themselves rather than let you do it. It's not a negative reflection on you as a person, but just a trait of a person with OCPD. Speaking of mental health, anxiety and depression are two of the most common mental illnesses. This is why it's important to spot problems in time and seek treatment. Let's keep the conversation going with a couple more videos, shall we? Check out 5 signs of depression that should never be ignored. You can also try 12 things you're doing because of high-functioning anxiety. Go ahead, click one, or better yet watch both and learn more about mental health. Did you know about OCPD before watching this video? Let us know in the comments below.